The American Physical Therapy Association has designated October as National Physical Therapy Month. The APTA sees this as an opportunity to reach out to the public and educate us about the unique benefits of treatment by a physical therapist. The team of specialists at Tri-County Podiatry explain the importance of physical therapy in the treatment of various foot ailments, as well as post-surgery rehab.
We do a lot of patient education, and I know the doctors do too. We'll get the foot out, we'll go over the anatomy of the foot, the bones, the ligaments, the tendons, but the plantar fasciitis, because it starts at the bottom of the heel bone and splays pretty much the entire plantar surface of your foot. So it affects a lot, and the pain can travel from the heel to the mid-arch all the way up to the toes. So we see a lot of that.
Usually it's just we have to educate the patient on why they have these conditions. When we get the people back into therapy, what we're trying to do is make them understand what the problem is, why they have it, how they possibly could have gotten it, and then implement a treatment of both stretching and strengthening of these muscles that could be weak. A lot of times we'll also see limited range of motion, and when we see limited range of motion, especially in the foot and at the ankle, the stress that would normally go through a foot in its full range of motion is being taken up somewhere else. The energy is being placed somewhere else, and usually we can see a lot of that in the Achilles tendon or plantar fascia. So if we're getting the range of motion back, if we're getting the muscles stronger, a lot of times the pains do subside. However, there are times when people are just very, very inflamed, so we have to use modalities, and we have electrical stimulation, ice, ultrasound, heat packs. We have a newer modality here called iontophoresis, which is really nice for people with Achilles tendonitis and even plantar fasciitis. What it does is it uses an electric pad that the patient will wear on the affected area, and it has a small little area for a charger, and it charges up these little batteries that allow a current to go through there. The iontophoresis is an excellent modality to get anti-inflammation drug into that area without having to risk the harmful effects of a injection in that area.
From day one, when you evaluate a patient, you want to at least let them know of some different exercises they can do at home in between the days, in between their treatments. But it's definitely, patient education is key, because you don't want to see them 2-3 months down the road after they've fallen or after they've had the same thing happen, the same injury. So when they leave here, you want to know that they're doing it right, and you want them to feel comfortable with what they're doing.
You'll find a map link and contact information for Tri-County Podiatry in the Villages, along with other foot-related stories, when you click the Physical Therapy Month StoryLink icon online at yourhometownhealth.com.